I'd just like to acknowledge the owners of the lands, their elders past and present from wherever we come from. And also I want to acknowledge the light keepers, the medicine healers who've been with us since the beginning of human civilization and have brought these medicines to where we are today. And we thank them and acknowledge them for their wisdom in using these ancient healing modalities and for continuing to do so to both heal us and to raise our consciousness. I just want to mention to everyone that all questions can be submitted via the Zoom Q&A function. So we're using a webinar feature today because of the huge number of people who've registered for this webinar. Due to the large number of questions, we need to let you know that not all will be answered. However, what you can do is you can upvote your favourite questions by clicking the thumbs up below a question, and that will move the question up the list so that we will then be looking at some of the highest voted questions. General comments can be posted in the chat, and a number of our team at Mind Medicine Australia will also be responding to questions as and when they can as well. So we're going to start off now with a short video which explains why we exist, and then some short welcome slides before I introduce Gabor to you. Thank you, everyone.
Did you know that over 45% of Australians will experience mental illness in their lifetime? That's nearly half of us.
I can't sleep. Everything feels flat and grey. I feel ashamed.
Mental ill health devastates lives and families and costs Australians around $60 billion a year. Research and treatment expenses continue to rise, yet rates of mental illness indicate that we're losing the battle. New approaches are urgently needed to address this immense suffering and cost. Psychedelic-assisted psychotherapy is currently being trialled worldwide and has demonstrated remarkable promise in treating depression, anxiety, addiction, and post-traumatic stress disorder, with new trials underway for treatment of dementia and anorexia. The treatment combines a short program of psychotherapy with just a few medicinal doses of psilocybin or MDMA. In the 1950s and 60s, psychedelic treatments had a major impact in psychiatry, and many considered it the next big thing in mental health treatment. But for political reasons, the Nixon administration criminalised the use of psychedelics and effectively stopped all research. That research has finally begun again. With proper clinical support, psychedelic treatments are safe and frequently lead to remission after only a short program, and even where current treatments have failed. Here at Mind Medicine Australia, we believe everyone should have access to the best treatments for mental illness. Subject to forthcoming clinical trial results, we will seek to establish best practice in regulated psychedelic-assisted treatment. Mind Medicine Australia is wholly focused on the clinical application of psychedelic medicines. We're preparing for change by developing therapist training, ethical guidelines, a centre of excellence in psychedelic medicine, educational material and events, and supporting clinical research. We're a small organisation doing big things, and we need your support. Please share this video and visit our website to support us and get involved.
Sorry, Tanya, you're on mute.
Okay, sorry, that's our short animated video, and we encourage you to share that widely. And we'll now show you just a few introductory slides before I introduce Gabor to you. Next slide, thank you, Ilan. And just to let everyone know that we will be recording this webinar and we will be publishing it on our YouTube platform as usual.
Turn it on.
Next slide. Next slide, thank you. So here in Australia, we have alarming levels of mental illness. These figures are pre-COVID. 1 in 5 Australian adults with a chronic mental illness, 1 in 8 adults on antidepressants, including 1 in 4 older Australians, 1 in 30 children on antidepressants as young as 4 years of age. Now, these figures have exacerbated significantly over the past year with this crisis, and we've also seen a massive increase in self-harm of young people. In Victoria alone, an increase of 33% during the second lockdown. It's also anticipated that 1 in 2 of us will experience a mental illness in our lifetime. And the most common illnesses, again, that we are focused on are post-traumatic stress disorder, other anxiety disorders, depression, and substance use disorders. If anyone is in the panel and has their microphones on, if they could please mute them immediately. Thank you. Next slide, thank you. Unfortunately, there's been no improvement in treatment outcomes over the past 50 years. So in the case of depression, only 30 to 35% of sufferers experience remission from pharmacotherapy and or psychotherapy. And in addition, as many of us know, the side effects from these medicines are significant, and they're also very, very difficult to withdraw from. In the case of post-traumatic stress disorder, the response is even lower and the remission rates are as low as 5%. So it's clear that a more of the same approach is not going to solve the massive challenge that we are experiencing in Australia and of course globally at the moment. Next slide, thank you. So Mind Medicine Australia is a charity that helps to alleviate the suffering caused by mental illness through expanding the treatment options available to medical practitioners and their patients. Our goal is to establish safe and effective psychedelic-assisted treatments in medically controlled environments. Our focus at the moment is on medicinal psilocybin, primarily for depression, but also addictions, and medicinal MDMA for PTSD, but also addictions as well. We're also interested in investigating other psychedelic medicines which are being trialled around the world. For us, success looks like these medicines become an integrated part of our mental health system, so that if you go to a medical practitioner, they will give you psychedelic-assisted therapy as a first-line treatment, so that you have the chance of having antidepressants or antipsychotics, psychotherapy, and psychedelic-assisted therapies with full disclosure of risks and benefits of all treatment options available to you. That the medicines will continue to achieve the high remission rates that they've been achieving in current trials, which are 60 to 80% in over 150 global trials that have taken place recently, which obviously far exceed the remission rates that are being achieved through existing treatments, and that they're accessible and affordable to all Australians in need. Next slide, thank you. So the remarkable thing about these medicines is they only require 2 to 3 medicinal sessions in combination with a short course of psychotherapy. And this is in contrast to conventional treatments, where often patients will be taking antidepressants potentially for decades or even a lifetime alongside a lifetime of psychotherapy, or have dropped out of the system. So mental illness doesn't have to be a life sentence, and I'm sure that Gabor will talk about that as well in his talk with you today. And the wonderful thing about these medicines is that they're curative. They're not just palliative. They're not just managing a condition. They're also considered to be very safe in medically controlled environments and non-addictive. Both have been granted breakthrough therapy designation by the FDA in the US to fast-track their approval process. And this designation is only given to medicines that are considered as potentially vastly superior to existing treatments. Next slide, thank you, Ella. I love this slide. So this has a little bit about the mechanism of action that's occurring, particularly through psilocybin on the brain. So what you're seeing here is the altered communication between brain networks, and particularly what happens with psilocybin is the bypassing of the default mode network. The default mode network is what keeps patients stuck in rigid thought patterns and loops of thinking, defaulting back to their original programs and patterns, usually connected to when an initial trauma and wounding or other kind of significant life event occurred that has kept the patient stuck back to where that trauma occurred. You can see that with this representation of an fMRI scans on the right. So the far right circle is showing you the very limited neural connections in someone who's suffering from depression. And then on the left, you see the intervention with the psilocybin, the massive increase in neurogenesis of neural pathways, increased neuroplasticity, in some cases, reconnection of old and damaged pathways. And this incredible sense of oneness and unity and connection that a patient feels with the psilocybin experience. And it is with that experience, which many people describe as rebooting or resetting the brain. Other people describe it as defragging the dodgy hard drive, where the patient has the opportunity to actually clear the slate and to start to move forwards with their lives instead of being stuck in their old stories and patterns, because they've gone back to the root cause of their trauma. The wonderful thing about these medicines is they do promote an active form of coping for the patient. They empower the patient for their own sense of agency, for their own healing, instead of taking a daily medication that in many cases may just numb out the patient and not allow them to experience their life and their feelings fully. Next slide, thank you. So Mind Medicine Australia is focused on 4 key strategies to build the ecosystem for these medicines. The first of those is awareness and knowledge building. So education and events like these, including this wonderful free webinar series. And this is certainly the most popular webinar that we've run so far. Thank you, Gabor, for that. It's been an enormous response. And we have some wonderful other webinars coming up as well. Dr. Robin Carhart-Harris, the lead investigator of the current trial at Imperial College, in a few weeks' time, who'll be revealing the results of the trial, the first trial ever, comparing psilocybin directly with SSRIs. And we already know that those results are extremely significant because he's mentioned that to us. We also have a major international medical summit planned for November, which Gabor and Robin and many others, David Nutt, Ben Sessa, and many of the leading researchers from around the world and leading doctors will be speaking at. And that's very exciting. We also have started chapters all around Australia to build a grassroots movement and educate communities one at a time so that everyone understands the science behind these medicines, and let's go of the stigma that has sadly been connected to these medicines for far too long. We also have started the first ever certificate in psychedelics assisted therapies in the Southern Hemisphere. And this part-time course commenced a few weeks ago with psychiatrists, psychologists, psychotherapists, doctors, physicians, mental health nurses, social workers, occupational therapists, and so on. So if you're out there and you're a therapist, and we know there's a lot of therapists on this webinar, then please feel free to register for our subsequent intakes. Our next intake's in July, and then we have more intakes. The one in July is getting pretty full, so you need to get in quickly. We're also looking at setting up an Asia Pacific Centre for Emerging Mental Health Therapies in partnership with universities in Australia for applied research and development, advanced rollout and manufacturing and growing of medicines in Australia, advanced rollout of clinics, so that there is indeed a real ecosystem to make sure that these medicines can be equitably available to people who are suffering the most and who need these therapies. And for many people, as we know from the daily emails and letters we receive, this for many people is they consider their last hope. In addition, we're focused on the legal and ethical framework. So many of you will know that we've recently submitted applications to the TGA, which is our Australian regulators, to reschedule medicinal psilocybin and MDMA to Schedule 8. So they're currently in Schedule 9, which is prohibited substances. And we argue, and many others do, that these should be in Schedule 8, which is controlled medicine, which makes them more accessible by special access pathways to doctors and their patients. Still, just to reiterate, the patients would never get to take the medicines home. So these treatments would only ever take place in clinics under the supervision of trained professionals. We also have a psychological support service. So if people out there are using medicines and need help with integration, we have some wonderful psychotherapists and psychologists who provide support through our psychological support service. So with that, I'm now very, very thrilled and delighted. Ilan, I'm up to the Gabor slide, I think. Yes, to welcome Gabor Maté, who after 20 years of family practice and palliative care experience worked for over a decade in Vancouver's downtown Eastside with patients challenged by drug addiction and mental illness. Best-selling author of many books published in over 25 languages. And I think we have more than, from what I've seen, Gabor, so far, we have I think over people from over 40 countries on this call right now, just at my quick guess. And Gabor is, of course, an expert in addiction, trauma, childhood development, the relationship of stress and illness. His book on addiction received the Hubert Evans Prize for Literary Nonfiction. For his groundbreaking medical work and writing, he's been awarded the Order of Canada, his country's highest civilian distinction, and the Civic Merit Award from his hometown, Vancouver. His books include In the Realm of Hungry Ghosts, Close Encounters with Addiction, When the Body Says No, The Cost of Hidden Stress, Scattered Minds, The Origins and Healing of Attention Deficit Disorder, and with Gordon Neufeld, Hold On to Your Kids, Why Parents Need to Matter More Than Peers. We're delighted that Gabor is a member of Mind Medicine Australia's advisory panel, and he's also going to be presenting at our summit, and he's also providing a teaching session to the certificate in psychedelic assisted therapies. He's a legend, which is why all of you are here today, and we are very honoured and privileged to have you here with us, Gabor. And we'd love you to start off, and then we know there's going to be heaps of questions, and Gabor would like this session to be as interactive as possible so he can answer as many questions as possible. Just unmute.
Okay, well, thank you, Tanya, and thank you to Mind Medicine Australia and for all of you for attending. I will not be presenting you with a didactic lecture. I'll just talk to you for, I don't know, half an hour or so, I'm not sure. And then Tanya and I will have a conversation, and then we'll have questions. So what I want to tell you. So we're living in challenging times, and quite apart from the COVID pandemic that has afflicted the whole world, our world has been getting more difficult for more and more people for a long time now. And as Tanya mentioned in the very beginning, in Australia, the number of people diagnosed or challenged by mental health conditions is increasing. This is true throughout the so-called civilized world. And that immediately raises a question. Because if we go with the usual medical assumption that mental health issues and addiction particularly are simply biological diseases of the brain, often based on genetic inheritance, if you go with that assumption, then how the heck do we explain that the numbers are going up so dramatically? So there's got to be something else going on. And as Tanya's introduction also mentioned, the system is not doing very well in dealing with these problems. Now, if that's the case, and this is the case for depression, for anxiety, for PTSD, for addictions, for any so-called mental health challenge, ADHD, if that is the case, then the question is it that we're not doing enough? Or are we doing too much of the wrong thing and we haven't really fundamentally grasped the issues at their roots? So that are we maybe just dealing with effects rather than causes? And I argue very much that the Western medical mindset, miraculous as its achievements are in so many fields, and as a physician, I know that as well as anybody, but at the same time, it chronically misunderstands chronic human suffering, and that the sources of the illnesses that it diagnoses, whether they have to do with what we call physical illness, that is to say cancer, autoimmune disease, or fibromyalgia, or chronic fatigue, or any inflammation of the body, or the so-called mental illnesses, we're missing the roots of them. And that's why we're so limited in our capacity to respond, because we're dealing with symptoms rather than causes. So then how do we understand causes? Well, the topic was meant to be on addiction. Let me say something quickly about psychedelics. Psychedelics were stopped for the wrong reasons in the 70s. But maybe from a certain point of view, it was a good thing that they were stopped. Why? Because they too, like everything else, have to be deployed with a proper understanding. And it's not clear to me that in the 70s, I could be wrong on this one, but it's not clear to me that in the 70s, we had a good understanding of what we're actually treating with psychedelics. So as powerful as the modality they can be, they too have to be used in the proper context, with the proper mindset, with the proper understanding. And the big shift that has occurred in the last 30 years or 40 years, even more recently, is our understanding of how much human physiology and human psychology is actually shaped by early experience and particularly early trauma. Now, when I say that our understanding has shifted, I mean the research is absolutely clear, it's overwhelming, it's persuasive, it's not controversial. That the research about trauma and human development and its long-term impacts on health, including physical and mental health issues, has not penetrated the medical world yet, is one of the greatest, I'd say, travesties in terms of healthcare that I can imagine. Because we keep talking about evidence-based practice, but there's so much evidence that we don't actually look at. Now, let me give you one quick example that has nothing to do with addiction. A study, I'm writing a new book now. The title is The Myth of Normal, Illness and Health in an Insane Culture. And the title tells you what it's about. I'm arguing that it's not individual disease that's abnormal. It's the culture that generates diseases is abnormal. And that diseases, so-called, physical or mental, are actually normal responses to abnormal cultural and personal circumstances. So let me give you one quick example. A study last year showed that, published from Harvard, that women with severe post-traumatic stress disorder have double the risk of ovarian cancer. Now, what does that immediately tell you? It immediately tells you that human physiology is inseparable from human emotional dynamics. And in this study, women who had lesser symptoms because their PTSD had been treated had less of a risk of ovarian cancer. So if that was the only study ever done, it should send every clinician running to figure out the mind-body unity and how emotions and physiology interact, and how life experience and physiology interact. And that scientific work has been done, published in tens of thousands of papers. So how do we apply that awareness to addictions? So addictions are always defined in terms of either a choice that people make, that some people just make bad choices. And of course, what do you do when you make bad choices? You punish them. So for some reason, in Canada and in Australia, it's the most oppressed people who keep making these terrible choices. So in Canada, First Nations, the indigenous people make up 4 or 5% of the population. They make up 30% of the jail population. And a young man in Australia who's indigenous has got about 25 or 30 times the risk of ending up in jail than a Caucasian male. And so we can ask ourselves, how come these stupid people keep making these stupid choices? Or we can realize that there's no choice at all here. So there's addictions have nothing to do with choice. They have to do with something else entirely. Otherwise, we just end up blaming people. Now, the other big idea on addiction is that it's this disease that you inherit. It's a biological disease of the brain. That's a step forward, because as long as something is a disease, at least you don't blame somebody for it. You don't punish them for it. You're going to treat them for it. And if they relapse, you're not going to condemn them for it. Nobody condemns anybody for having a relapse of cancer or multiple sclerosis. Why are we condemning people with addictions if we truly believe that it's a disease? Having said that, I'm going to say to you that addiction is neither a choice nor is it a disease, even though it behaves like a disease in some ways. And you can see changes in the brain as a result of addiction. But I got news for you. You can see changes in the brain as a result of gaming addiction as well. People that do a lot of games on the internet, their brain changes for the worse. People that eat junk foods, their brain changes for the worse. So this idea that drugs change the brain and that's the source of addiction, yeah, drug use does change the brain, as does any habitual compulsive habit. But that doesn't mean that the brain was the source of the addiction. And what actually happens with the human brain, it reflects life experience beginning in the womb. So I'll give you a definition of addiction that some of you may have heard me articulate before, and just play along with me here, okay? So addiction is manifested in any behavior that a person finds pleasure or temporary relief in, and therefore craves, but suffers negative consequences as a result of, and does not give up despite the negative consequences. So here it is again. Pleasure, relief in the short term, therefore craving, negative consequences in the long term, inability or refusal to give it up despite negative consequences. That's what an addiction is. Nothing to do with substances. It may have to do with substances. It could also be eating, as I've said, gaming, sex, pornography, gambling, bulimia, self-harm, shopping, work, just about anything that meets those features. So what I want to ask you to do is, in yourself, ask yourself, according to that definition, have I ever had an addictive pattern in your life? And if this room, which I can't see, is like any other room I've ever spoken in, the vast majority of hands will go up at this point. And now I'm going to ask you a question, which I'll ask you to put on the chat line, just so I can read it. I'm not going to ask you what you're addicted to or when, for how long, I don't care. I'm going to ask you, what did you like about it? What did it give you in the short term that you appreciated? So I'm just going to wait for some of you to put your answers on the chat line. What did you get? Comfort, escape pain, numbing, respite from your mind, community, confidence, distraction, power, solace. Thank you. I'm going to stop looking at the chat line now. Let's look at these answers. Physical pleasure, comfort, escape from pain, numbing. Now, when do you need numbing? When you go to the dentist, when it hurts. So relief from pain, escape from your mind, stress relief, peace of mind. Now, is peace of mind a good thing or a bad thing? Is pain relief a good thing or a bad thing? Is relief from stress a good thing or a bad thing? Is being connected to other people or feeling connected a good thing or a bad thing? Is a sense of power a good thing or a bad thing? These are all wonderful things. These are all qualities in our life that as human being, focus and concentration, somebody says, you just diagnosed yourself with ADHD, by the way. You should read my book on it. The point I'm making is that the addict just wants to feel like a normal human being ought to feel, at peace, capable of handling stress, connected, powerful, confident, free of pain. In other words, the addiction wasn't your problem. Your addiction was your attempt to solve a problem in your life. And the real question is, how did you lose peace of mind? How did you become so overwhelmed by stress that you didn't know how to handle it? What happened to you? Where did you lose your sense of connection to yourself or other people? How did you lose your sense of power as a human being? That's the real question. And to answer that question, we can't look at your genetics. It's trivial to talk about choices because nobody chooses to lose all these things. We have to look at your life. And what we have to look at is how you lost the connection to those essential qualities of a human being that we just listed. And that has to do with trauma. And trauma simply means a wound. Trauma comes from a Greek word for wounding. So the point I'm making to all of you is that all addictions, I don't care what form they take, and all mental health conditions, and many physical health conditions, which I don't have time to talk about here, begin as adaptations to trauma, to wounding. The problem is that we make these early adaptations in childhood. For example, numbing. Well, when do you have to numb yourself? When there's pain that you can't handle. Well, why couldn't you handle the pain as a child? Because life is painful. But why couldn't you handle it? Because a child can't. For a child to be able to hold their pain and to be able to go through it, and to know the confidence that they can experience it without being overwhelmed by it, they have to have emotional connection with nurturing adults. When that was missing and you experience pain, you literally numb yourself to escape the pain, and you don't do that deliberately. It's not like you say, oh, I'm going to numb myself. It's unconscious. And that pattern then becomes stuck in your mind. In fact, it gets built into your brain because the human brain, including the neurotransmitters, the dopamine and the serotonin and the GABA and the norepinephrine, all these essential brain chemicals, oxytocin that connects you to other people, the endorphins that give you pleasure and reward, and that also help you connect with other people and relieve pain. All these chemicals and all the receptors of these chemicals develop in interaction with the environment. And the more stress there is, the less these circuits develop properly. So yeah, you might say that mental illnesses represent some changes in the brain, but those changes were created by life itself. So you can stress pregnant animals in the laboratory, and their offspring will have fewer dopamine receptors in their brains as adults. That means now they want to do cocaine or crystal meth or some other addictive behavior to elevate their dopamine levels. Not a choice, not a disease, a normal response to abnormal circumstances. So that's the thing we have to get about addiction. And the problem with most addiction programs is they don't acknowledge that. They focus on the behavior of addiction, but they don't look at the underlying dynamics. So my mantra on addiction, that some of you have heard me utter before, is the first question is not why the addiction, but why the pain. And that, by the way, when I come to talk about psychedelics, that's where the psychedelics come in. Now, let me gather my thoughts here. So, addictions then serve fundamentally to soothe pain. Specifically, they can also be a form of self-medication. For example, people with ADHD tend to do stimulants like cocaine and crystal meth to elevate their dopamine levels, which is exactly what would happen if we gave them Ritalin or Dexedrine. So they're self-medication. People with PTSD self-medicate with opiates because the opiates soothe the symptoms of PTSD. People with depression might use cocaine. They might use alcohol. People with bipolar illness tend to use alcohol both to soothe the highs, to bring them down, or to elevate the lows of their bipolar states. And the most famous example, perhaps, is Vincent van Gogh, the Dutch painter, who talked about the alcohol soothing the highs and elevating the lows of his bipolar condition. The brain circuits of addictions, the stress relief mechanism, the endorphin mechanism, the dopamine mechanism, they all develop in early childhood in interaction with the environment. I'm going to quote you an article from Harvard University published in a major journal a few years ago. The interactions of genes and experiences literally shapes the circuitry of the developing brain and is critically influenced by the mutual responsiveness of adult-child relationships, particularly in the early childhood years, which means that the most important influence on the proper development of the human brain is the quality of human relationships. And in Western societies, we're in deep trouble because kids are no longer brought up by their parents for the most part. They're no longer brought up in the context of the clan and the tribe with multiple nurturing adults. They're no longer brought up with multiple playmates of different ages. They no longer get to play out there in nature. This is how we evolve, people. This is what our brain needs for healthy development. The more civilized we get, the more further away we get from the natural conditions in which we evolved. And Jean Lidloff wrote a wonderful book called The Continuum Concept, where she visited this Aboriginal tribe in the jungle somewhere in Brazil, I think, or wherever it was. She talks about that the human organism is an expectation. So we evolved as an expectation. Our lungs are an expectation for oxygen. If it wasn't for oxygen, we wouldn't have lungs. We wouldn't exist. But if we did exist, we'd have to exist as a different creature, not with lungs that we have. So our lungs are an expectation for oxygen. Our whole organism is an expectation for love and nurturing. It's that simple, people. That's what our expectation, that's what we're an expectation for. And as a wonderful psychologist in the States says, human beings are creatures with special needs. All human beings are creatures with special needs. And those needs are for contact, for comfort, for nurturing, for holding, for love, for play, for being cared for. Those are the special needs that we have. We can survive if those needs are not met, but we won't be our true selves. We have to adapt ourselves, bend ourselves out of shape to survive in an environment that does not need our needs, that does not value our nature-built expectations. So whether from the point of view of physiology or psychology, when the conditions are appropriate, we develop the way we ought to. And when those conditions are deprived to us, either seriously or I should say overtly through trauma, abuse, neglect, which is what many hardcore drug users have experienced, or just through parents being too stressed or too distracted or too economically challenged or too troubled by their own unresolved issues, that child, that infant will not have their needs met. To that extent, their development can be disturbed. And the more genetically sensitive the child, the more disturbed that might become. So whereas sensitivity can be a wonderful template for creativity and art and leadership and intuition, it can also be a source of deep pain, because the more sensitive you are, the more you feel the stresses and the travails of your environment. So some myths around addiction: it's not an inherited disease, it's not a choice, it's not a genetic problem. Um, Addicts, when it comes to treatment, addicts actually need, but first of all, even the word addict, when you think of the word addict, right away you have a certain picture in your mind. I would love to outlaw the word addict. I would love to make it illegal ever to say the word addict ever again. I would love to pass a law, not that you can legislate language, but if you could, I'd love to have a law that says next time you want to say addict, you'd have to say so and so is not an addict, but so and so is the human being who suffered so much in life that he or she or they resorted to such and such a behavior to escape from their pain. What if you have to say that? What if you said that every time you want to use the word addict? Right away, it would change your attitude like that. One more thing about addiction. We tend to think of addiction to drugs or to sex or to pornography or to gambling as sort of separate issues. And the DSM, the Diagnostic Statistical Manual of the American Psychedelic Association, that's how it treats addictions. Now, that's not the only thing that the DSM gets wrong. It gets virtually everything wrong, not in the detail, but in the conception. But actually, there aren't multiple addictions. There are multiple targets, but there's only one universal addiction process. And that's the same in the brain and in the personality of the individual with drug addiction or substance addiction of any kind, nicotine addiction, caffeine addiction, sex addiction, eating addiction, shopping addiction, and so on. It's the one universal addiction process with different manifestations and different severities depending on the degree of suffering and very often on the degree on the socioeconomic class of the individual. But it's the same process. And we do live in a society that isolates people, that stresses people to the max. I mean, long before COVID, Britain had to appoint a minister of loneliness. Can you imagine a minister of loneliness? That's such an epidemic of loneliness in the Western world these days. So we live under conditions which foment addiction because they hurt people. Dr. Bruce Alexander, a psychologist here in Vancouver, wrote a book called The Globalization of Addiction. And he talks about psychosocial dislocation, which means a separation from a sense of connection to oneself and to community. And so, if on the individual level, the template for addiction is trauma and childhood wounding, on a social level, the template for addiction is the increasing dislocation, separation, loss of meaning, loss of connection of people with one another, with their communities, with their world. In other words, these are not individual brain problems. These are problems of life experience and problems of uh, social experience, and very often problems of social policies that foment and promote these conditions that actually hurt human beings. And then no wonder, of course, that the ones most likely to be affected are the ones most traumatized. For example, the colonized peoples in Australia and here in North America. The beauty of it is, now let me just give you a little bit on healing and then psychedelics, and then I'll stop. So, trauma is not what happened to you. This may be strange for some of you here, but trauma is not the sexual abuse. It's not the beatings. It's not the parental stress. It's not the neglect. It's not your mother's depression. That wasn't the trauma. That was the traumatic event. But the trauma was what happened inside you as a result of those events. So don't forget, I said trauma comes from the Greek word for wounding. Well, wounding happens inside of ourselves. It's not what happened to us. The wound is not what I was hit or cut. The wound is what happened in my body as a result. Well, that's a good thing. Because if trauma what happened to you 20 years ago or 30 years ago, or in my case, 76 years ago, what can you do about it? It happened. But if trauma is what happened inside you, and that loss of connection with yourself, then that connection is available to you this very second. So trauma can be healed in all cases, given the right conditions, which for the most part are not available to a lot of people, but at least potentially it's available to everyone. There are many treatments for trauma, and I'm not going to talk about them now. I have developed one approach. It's called compassionate inquiry. It's not the be all and the end all, and I'm not comparing it to anything else. I'm just saying there's many different approaches. I have one. Other people have others, very well-known ones. I'm going to talk about psychedelics next, not because I'm a psychedelic evangelist. In fact, let me tell you why I'm not a psychedelic evangelist. As powerful as these modalities can be, the psychedelics, it's hard for me to see how there'll ever be the answer, because they'll never be available to a lot of people. In the foreseeable future, there will not be enough trained practitioners who are really good at what they're doing, who've got the time to sit with people, because these things are time consuming. It's also expensive. Now, I'm not arguing against them. And there's also a huge legal sanction against them in most countries, which is only very slowly being chipped away. So I don't want to put all my eggs into the psychedelic basket. And furthermore, a lot more have to happen on the social level and on the health field level, on the healthcare level, to heal trauma beyond psychedelics. Having said that, let's do talk about what psychedelics can provide that I've witnessed myself. And I worked with them for about 12 years now, both personally and also facilitating psychedelic healing for others. So let's make a distinction between drugs and psychedelics. Sometimes people say, well, you're talking about ayahuasca or mushrooms or MDMA. Why are you talking about drugs? I'm not talking about drugs. There's a huge difference, depending on how you use the words. But the drug, for my definition, for this purposes here, is a substance that you take to change the chemistry of your brain because something is happening. We don't know what, but these drugs can sometimes have a positive effect, but they don't deal with the underlying issue that created the addiction or the mental health problem in the first place. They soothe the symptoms, but they don't deal with the underlying issue. And there's symptomatic relief, they don't go to the cause. And you have to keep taking them every day for however long. So their effect depends on the change in the brain chemistry, whatever it is, that lasts as long as you're on the drug. The psychedelic medicines are not like that. Nobody recommends that you take ayahuasca every day. Nobody recommends that you take a strong dose of mushrooms every day. Some people microdose, but even then it's not every day. So it's not about a continuing drug use. It's a medicine designated or designed to promote healing. And how do they do that? Well, they do it in two fundamental ways. And this is a simplification, and I'm giving you my understanding of them. A lot of people are traumatized, but they spent their whole lives running away from the trauma or from the pain of the trauma, the pain of the wound. A lot of their lives are organized around running away from their pain. That's where addiction comes in, for example. That's where a lot of behaviors come in. And the pain was so devastating when they first experienced it that they actually already in childhood repressed it, they pushed it down, they separated from it. So they don't even know what they're running away from. Now, let me tell you, in the right safe context, and given where you're at, those psychedelics can put you deeply in touch with the most profound pain you've ever experienced. This is what people call a bad trip, except in the right context, there's no such thing as a bad trip. There's a difficult journey. There's a painful experience. You might experience fear. You might experience terror. You might experience rage. You know what you're experiencing? You're experiencing that which you'd pushed down in yourself long ago, maybe already in the womb, and certainly sometimes before you have any recollection of it. That's what's coming up. So it lets you see what you've been running from all your life. But the reason you've been running from it is because there's nobody there to hold you. Well, now what if in an experience today, you experience the pain, the rage, the terror, the nightmarish images that your mind will throw up at you, but you felt safe, you felt held, you were understood, you were supported. That's the whole idea of um, of psychedelic supported psychotherapy. And that's the whole idea of ceremony or these experiences, is that you can actually experience things that are real inside you. That it's not the plant or the medicine or the ayahuasca that makes you feel afraid or terrorized or gives you nightmares. No, they just reveal what's been inside you. Do you want to know what's inside you, or do you want to keep running? So that's the one value, that it's like having a very, very powerful dream that tells you what you need to know about yourself. As, by the way, dreams do. We just often don't know how to interpret them. Now, the other thing they do is that love, that connection, that power, that clarity, that courage, that joy that you're looking for in the addiction. Guess what? Those are normal human qualities. They're yours. And nobody could ever take them away from you. They could treat you in such a way that that you suppress them and you lost contact with them, but you've never lost them. And let me tell you, this is a struggle for me sometimes, because there's certain qualities that I've really got detached from very early in life. Still working on it. But when in the ceremony or under the influence of the medicine, your ordinary mind gets quieted and gets out of the way, and its defenses are relaxed. Sometimes you can experience that power and that joy and that connection and that oneness and that love that is actually, not only is it yours, it's actually you. So you actually get to experience you. You get to remember yourself. So on the one hand, you get to see and experience what you've lost, the pain and the terror that you suppressed a long time ago, and you get to experience the real you that you lost at the same time. Now, that's great. Is it enough? No. You can have these beautiful experiences or powerfully meaningful experiences, but unless they're integrated into your life, they're going to be memories. And memories are not enough. They're helpful, even inspiring, but not enough. So the real work of integration begins after the event. And that takes work. And that integration has to happen in your intrapsychic life, in your spiritual life, in your relational lives, if you're in relationships, in your work life. And so that what the psychedelics do, they open the doors of perception. They can do that. But walking through those doors then becomes an ongoing task. Very few people simply have an experience and are then just all of a sudden transformed by it. I've seen it happen. But that's not the usual rule. The usual rule is that you have to keep walking the path. I'll say one final thing, which is that specifically when it comes to addictions, psychedelics can be very, very powerful. And depending on which addiction it is and which substance, these are highly promising modalities. I mean, I mentioned one psychedelic called Iboga, which when it comes to opiate addiction is far more effective than anything that medicine even vaguely dreams about in the right hands under careful conditions. And yet, in most countries, it's illegal, and most addiction providers have never even heard of it. So in the psychedelics, there's tremendous potential to be explored and to be built upon. It's one of those modalities that were absolutely insane not to embrace. I didn't say throw ourselves into, I said embrace as a legitimate, valid, and more than hopeful adjunct, or not adjunct, but pathway towards healing. So I will stop here and begin our conversation. Somebody wants to know if I have healed. Let me, I'm not going to keep answering questions on the chat line. I'll let Tanya handle that. But, it's ongoing work. I said this before, but might as well tell this group. I've written my epitaph. This is what they're going to carve on my gravestone. It's going to say, it was a lot more work than I had anticipated. And that work is going to continue until they lay me in the ground, I think. That's how I think it is for me. Now, who knows? Maybe I'll get totally enlightened this week. I hope so. But I'm not totally optimistic about that.
Mm.
On the other hand, let me tell you this as well. I've just turned 77, and I would not wish to be as young and stupid as I was when I was 76. So we can move forward even as we grow older. So, Tanya.
Wow. Yeah. Wow. So wise, and thank you again. It's such a privilege for all of us at Mind Medicine Australia to have you on this call. There's heaps and heaps of questions. I just wanted to ask a couple of questions as well. Obviously, you talk a lot about we're looking for ourselves. Why have we lost ourselves? Why is it so difficult to reconnect? And how do these plant medicines really help us to find ourselves? I mean, I think you've gone to a large extent on that, but how else do you feel that these medicines in particular are helping people to reconnect? Because it is so difficult to reconnect once that initial disconnection has occurred.
Well, so the disconnection happened in a relationship. It happened in a context. And there was a reason for it. So the disconnection wasn't a mistake. The disconnection was a survival adaptation. At a certain point, we learned that to be ourselves would invite trouble. Because the environment could not handle who we were. In fact, it rejected who we were. So the disconnection was for survival. It wasn't like we somehow made the wrong choice, made no choice at all. Our brain just did what it needed to do to help us survive. But then that same disconnection creates all kinds of suffering. So since the disconnection happened in relationship, what if now you were in a situation where you were nurtured and held and respected and seen and accepted and where you felt safe? All of a sudden it becomes safe to reconnect. For survival, I no longer need to disconnect. So what actually happens is that that survival need to disconnect all of a sudden becomes unnecessary. And with the psychedelics, believe me, you get how unnecessary it can get. And especially if you're with people that have integrity and have pure hearts and have actually worked out their own stuff. Because let me also warn you, in the psychedelic world, there's a lot of dysfunction as well. There's a lot of ego. There's a lot of exploitation, sometimes sexual exploitation. So it's not like I want to paint any kind of an idealized picture. Any pathway can get corrupted. Spiritual pathways, as we all know, how many great spiritual teachers have ended up exploiting and philandering and so on. But so we have to maintain the purity and then be vigilant about the integrity of this approach. But in the right context, there's no need to disconnect anymore. And that's what you get.
Thank you. And I've seen quite a lot of questions that people saying they've got ceremonies coming up this weekend and so on, and what sort of advice you'd give. And particularly, I think that might be advice about how to set the right intentions, the right inquiry pre-ceremony, so that people can get the best healing experience from that. And then, of course, the integration to follow.
Well, when I work with people to set intentions, it's a very one-on-one process, you know. So I have to know about their lives, what they're challenged by, what they're looking for, and then I help them formulate intentions. So I can't give you a generic answer to that because it's an individual thing. But two good intentions, two baseline intentions that I think are essential are to stay present, intend to stay present. And when your mind carries you away, come back to your body. So stay connected to your body. Doesn't matter what your body's telling you. And be curious about everything. Don't believe anything, but be curious about it. So if a plant or a substance gives you an image, don't just go, I mean, yeah, explore it, but also be curious. Well, why are you showing me this right now? So keep asking, stay curious. So stay curious and keep connected to the body. And what will often happen is that the least understandable and the most bizarre or troubling images that may come up for you, if you connect to the emotions around them, they represent your repressed memories. So stay curious. That's what I can say
Fantastic.
about intention. If I was working one-on-one with somebody, I would work more directly with them as to formulate what their intentions ought to be. But whoever you're working with, at least discuss the intention. Try to bring it in to the present. That's okay. Now I'm going to explain, why am I going into it? What am I looking for? What questions do I want answered? Sometimes people
Thank you.
sometimes people want to experience the, let me see my childhood pain, or let me see my childhood, or let me find my courage, help me glimpse my joy. Just, you know, but when you set the intention, don't stay compulsively, rigidly attached to it. Oh, I'm not seeing what I wanted to see. No, whatever it shows you, be curious. I wanted to see joy. Why are you showing me terror? Instead of, I'm not seeing what I wanted to see. Oh, isn't what you're showing me? Okay, why? What do you want me to get? So stay curious.
Thank you so much, Gabor. Now I'm going to, there's stacks of questions here, so I'll ask them as quickly as I can, and we might do some sort of speed questions and answers to see if we can get through some of these wonderful questions. This one here from Sarah. Research is now being done with psychedelics for a wide range of DSM disorders, PTSD, depression, substance use, eating disorders, autism, anxiety, etc. Basically anything that isn't in the psychotic section. Do you think psychedelics might help psychiatry move away from a symptom-focused DSM and into a new formulation of mental illness? Also, what do you think of the exclusion of psychotic disorders? Could there also be space for them in the psychedelic movement?
So Michael Pollan, who wrote this very well-known book, How to Change Your Mind on Psychedelics, I was talking to him and I said, were you surprised by the response to your book? And he said, yes. Particularly, I was surprised by the response from the psychiatric profession, because I expected to be just denounced or renounced. But in fact, many of them expressed a lot of interest and curiosity. A lot of psychiatrists do get that what they're doing is not working, or what they're doing has got limited efficacy, and sometimes it does more harm than good. So, and there are psychiatrists that I personally know who are really seriously investigating in their own practices their relationship to psychedelics and their possible use. So that's happening. And I think a lot more has to happen to psychiatry. Again, I don't want to narrowly focus on psychedelics. I think psychiatry needs to become trauma informed first. If I could have one wish for them, I should say, it would be that it becomes trauma informed, then psychedelic informed, not the other way around. But yes, I think that's beginning to happen. And psychedelics are beginning to inform some psychiatrists that there's a broader way to understand mental health conditions than they were taught. The question on psychotics, here's the deal. Sometimes psychedelics, occasionally, and I've seen this happen, can trigger what we call psychosis. Very rarely, but it can happen. That's not the end of the world. The question is there the holding environment? Can somebody who's been labeled psychotic, who've had that kind of breakdown of separation from reality, be treated with psychedelics? I don't know that we have information enough for me to answer that question. In fact, I know I don't have enough information for me to answer that question with any scientific certainty. I'll tell you my hunch, which is that if we had facilities that were out there in nature, where there was a holding environment, where there was a lot of safety, where there was a lot of personnel, we could treat psychotics as long as they could be there for as long as they need to be. And they could be as psychotic as they needed to be. Then my guess is that the psychedelics could be a useful adjunct. But in the modern day context, where people get together for a weekend, my God, do I really want to take somebody who's already separated from reality? Well, at least in a certain way. In some other ways, they're more connected to reality than the rest of us. I've seen that too. But who are dysfunctionally separated from reality, and then have a ceremony or an event or a healing psychotherapeutic experience, and then send them back into the world. So I'd say in the present day context, no. In an ideal context, I would see all kinds of potential.
And it is interesting to see that there is some research starting to emerge with schizophrenia and psychedelic assisted therapy. So that's going to be interesting to follow.
Yeah.
This next question here is, what thought-provoking question would you ask someone so that they may question their belief set or the stigma around psychedelic therapies or usage?
So is the question that how would you talk to somebody who's skeptical about psychedelics?
Yes, I believe so, yes.
Okay. I would ask them what their
Something
concern.
we come across a lot.
I would ask them what their concern is,
What is their concern?
and that, then
Mhm.
I'd ask them on what evidence is that concern based. I would say, well, that's a
Mhm.
fair concern. If I believed as you do, I'd be worried too. But what is the
Mhm.
evidence that you base that on? How do you know that that's the case? And are you open to looking at evidence that says otherwise? If you're not open to it, there's no conversation. I get it. That's how you see it. That's how you see it. But so ask them. So, really listen to them. I mean, their concerns are valid. What may not be valid is the information that the concerns are based on. So at least you have to validate people's concerns.
Thank you. And there's a question here: with the narrative of family in all its forms, including communities of care, being displaced, downplayed, and disenfranchised in the fast-moving modern world, what tips would you have for people working in social work, social therapy, of other human services, how to raise the status of the importance of a community in supporting and building compassion and resilience?
I would really like it, Tanya, if you could summarize that question for me. Not to
Yeah,
reread
it is
it,
a short
not to
question.
reread it, but
No.
to tell me what it means.
I think what it means is that, you know, the concept of family and community is so devalued in today's society. How do we actually help people to really reconnect back into community so that there can be more support from a community for people who are suffering, I guess?
Yeah.
So that they can reconnect.
Well, you see, that's essential question. The answer cannot be an individual one. We live in a society that just foments separation left, right, and center.
Yeah.
And so you have to start really asking some questions about the very nature of globalized society. So on a certain level, it's a political conversation.
Mm-hmm.
On a more immediate local level, uh, at least you have to be aware of what we've lost. So here's the problem, like this book I'm writing, The Myth of Normal. We tend to think that what exists right now is normal. This is normal. And in the sense that it is the norm, it is normal. But normal has nothing to do with healthy or natural. We've actually lost both healthy and natural. And what is normal now is abnormal in terms of human needs and human development. So we have to really get what we've lost. And in individual families and in neighborhoods, whatever platform and whatever venue on which you operate, you just need to do what you can to rebuild those connections and to encourage parents to stay connected to their kids.
Yeah.
There's so many different levels that this has to play out on, but it has to begin with awareness of what we've lost. Most people are not even aware that we've lost something. They just think this is the way life is. Well, this is the way this life is, but it's not the way life is.
No, we need all those lost connections back again, don't we? This is from an anonymous attendee who says that they're at the early stages of cocaine addiction. I see its harm, but enjoy it very much. Should I get harmed by the addiction some more or be ready for healing? Sorry, what's the
Well,
question?
how about if you how about if you remove the word should? I mean, I'm not here to tell anybody what they should do. And if I can use a should word, you shouldn't even tell yourself what you should do. What I would do is explore in yourself, what is the need that the cocaine is serving? It's doing something for you. What is it doing for you? Does it make you more alert, more vital, make you feel more alive? Does it make you more focused? Do you maybe have ADHD, which is a typical template for cocaine addiction? Not that everybody with cocaine addiction has ADHD, but about 30% of people do. So first of all, ask yourself, non-judgmentally, what's it doing for me that I like? You say you enjoy it, but that's too vague. There's something about it that you enjoy specifically. What is that something? And grant yourself the right to experience that something. And then ask yourself, how did I lose that something from my life? And then also ask yourself, what are
Phone
my
call.
concerns about? Also ask yourself, what are my concerns about it? What am I afraid of? In other words, have a conversation with yourself, not with this is what I should do or this is what I shouldn't do, but get to know yourself. And when you get to know yourself enough, you'll make the decision. In the meanwhile, if you're going to keep using cocaine, my advice to you is use it consciously. Say to yourself, right now, I can't stand how I'm feeling. I need a hit. I'm going to make a decision to use it. And I'm going to observe very carefully its impact on me, both the immediate high, the positive impact, and what happens afterwards. So stay conscious and stay curious and stay not judgmental about yourself. And don't ever tell yourself what you should do or what you shouldn't do.
Thank you. Well, great advice. And there's quite a lot of people also asking about Ibogaine and the use of Ibogaine to treat addiction. Did you want to comment on that?
Well, so specifically with opiate addiction, and I've seen this repeatedly, you can be a heroin addict for 20 years or on methadone for 10 years. And then if you stopped, of course, you'd have terrible withdrawal. But with the proper administration of Ibogaine, you don't have withdrawal. So within a day or two, you don't have withdrawal symptoms. Now that has to do with specific chemical properties of Ibogaine and its impact on the brain. That doesn't mean that it's over, because there was a reason why you used it in the first place. And those reasons haven't gone away. It's just that the withdrawal doesn't happen, which is the worst part of stopping opiates. So again, it gives you an opening to deal with the issues. And there's no substance, there's nothing like that in the Western pharmacopoeia that even remotely resembles Ibogaine in that impact. Now, Ibogaine can also pose dangers to the heart in some people, so it has to be carefully screened and so on. But for most people, it again is no panacea. But what if it succeeded 30% of the time, or 40% of the time, which is probably about right? It's still much more powerful than anything we have out there. In fact, we have nothing like it. And some people need more than one Ibogaine experience. But it's not for the faint-hearted either.
No, it sounds pretty cool, I was going to say.
I mean, I've had the experience, not for opiate addiction, but I've had the experience, and it's not for the faint-hearted.
You're a braver man than me. How do you address resistance and barriers to healing using compassionate inquiry? Another question that's come up.
Would you say that again?
How do you address resistance and barriers to healing using compassionate inquiry?
Compassionate inquiry, again, is the approach that I developed and teach online. Well, resistance is an interesting word, because is there such a thing as resistance in the abstract? There isn't. You're always resisting something. Now, if I'm working with somebody and they're resisting me, I can make the assumption that there's something wrong with them, or I could be curious as, what am I presenting them that they're resisting? Why are they pushing back? Maybe I'm pushing on them. Maybe you have a point of view that they should be different. Maybe they don't want to be changed. So they're going to resist, as they should, because you have no right to change anybody or to demand that they be different. So when I work with people that might be called resistant, I'm always interested in what I'm bringing to the table myself that they're resisting, rather than labeling them as resistant. Now, some people just don't want to engage, and if they don't, that's their right. You know, Yogi Berra, the baseball player and coach said once that if the people don't want to go to the ball game, there's nothing you can do to stop them. Think about that one. If people don't want to go to the ball game, nothing you can do. If they don't want to play your game, there's nothing you can do to stop them. As long as you made sure that you're not pushing on them. Because if you're pushing, they are going to resist, as they ought to. Even if you're trying to push them in the right direction, you're still inviting resistance.
Another great question here is, do you have any insights into why, in spite of many years of research and intervention development in mental health, we are not seeing suicide rates decline? And I'd probably add to that, obviously, and you reflected on this earlier, but obviously rates of depression, PTSD, and everything that lead to suicide.
Well, first of all, because all this research, for the most part, ignores trauma. I mean, most psychiatrists don't get a single decent lecture on trauma, let alone the average physician. They may hear about PTSD as a specific entity, but in terms of the universal role of trauma in creating the template for mental health conditions and suicidal ideation, they don't really deal with that. So you're going to do all the research in the world. If you're not looking in the right direction, it's not going to do you much good. That's the first part of the answer. The second part of the answer is, even if the research was going in the right direction, which for the most part, it isn't, although in some ways it is. I mean, on the positive side, Bessel van der Kolk's book on trauma, The Body Keeps the Score, keeps showing up on New York Times bestsellers list, for God's sakes. Well, that's incredible compared to 20 or 30 years ago. So that's good. But the other part of the problem is, even if you had the right tools, it's like imagining ladling water out of the ocean, and you're doing it with really good spoons. But meanwhile, the sky keeps pouring water into the ocean. In other words, it's not just a question of the research failing or the treatment failing. It's also a question that social conditions are getting worse that promote mental illness, or so-called, and promote suicidality and self-harm and addictions. So it's not just a question of are we doing the right treatment? It's also a question of look at the conditions that are promoting the problems. They're vast and they're social, and they keep getting worse.
Thank you so much, Gabor. There's so many more questions. What we're just going to quickly do now is finish with a couple of slides of the upcoming events, and then we'll come back and say a thank you to you in a couple of minutes. And if there's one more burning question that arises, we may ask that in a moment as well. So we'll just do a couple of quick slides now. Ilan, if we could pop them back on, just the final slides. Thank you. Yeah, so our webinars are free, but we do encourage people to make donations because, oh, there's a funny noise there, because we are philanthropists, but we can't do this alone. So we encourage you all to help support us. Next slide. Thank you, Ilan. This is our psychological support service, which I mentioned earlier. So if you are working with these substances, not that we advocate recreational use, but if you are then and you need some support, we have a wonderful service that is national with wonderful therapists to help support you on your journey and with your integration. Next slide, thank you. So Tim Ferriss, who's one of the great donors in this space and also investors in this space, says that he sees this next 5 years as an absolutely golden window, that with small amounts of money, and this includes donations, and particularly donations, you will have the opportunity to affect millions of people's lives. So all of us can come together in this movement to help make sure that these medicines do become available, alongside many of the other tools which Gabor has spoken about. Next slide, thank you. So these are the ways that you can help. We have state and regional chapters, obviously sharing this and other events, talking to your doctors and medical professionals, registering for the certificate in psychedelic assisted therapies, attending our events, our webinars, speaking to your local members of parliament. A movement requires movement. So we encourage you all to take a lot of action with your hearts and with the evidence, and focus on the science, as Gabor said, to unpack what is people's concern with these medicines, and then have enough knowledge about the evidence so that you can show them the evidence, which is very compelling. Next slide. So we ask you all on this call, we have until Thursday, the 4th of March, to challenge the TGA's interim decisions not to reschedule these medicines. Obviously, it's critical to have them rescheduled, and the reasons that have been given by the TGA can be challenged. There's quite a few errors in those interim decisions. So we encourage all of you to put in a written submission if you can. We've got a great how-to guide, which we'll put on the chat if we haven't already, and we'll put it again on there now. And if you don't have time to write a submission, at the very least, please put oppose, that you oppose the interim decisions for both MDMA and psilocybin. And the more of us that can do this, the more it will show the TGA and other influential leaders making decisions on these medicines just how important these medicines are to help heal the enormous suffering that's in our community. Next slide, thank you. This is our certificate, and there's way more information on this on our website. And the next slide. So this is our wonderful International Summit on Psychedelic Assisted Therapies for Mental Illness in November. We're thrilled to let you know that we've already sold over 300 tickets, I think, for that. It's preceded by a 2-day workshop in psychedelic assisted therapies for those of you interested in being therapists in this space. And as you can see there, we have really many of the leading researchers and guides and visionaries and doctors in this space globally. So we invite you all to join us for that. Next slide, thank you. And here's some upcoming events. We'll be refreshing this calendar shortly with a few other wonderful events that we're planning. The one there that I mentioned, Dr. Robin Carhart-Harris, Wednesday, the 24th of March, will be illuminating on the findings of the Imperial College trial comparing psilocybin with SSRIs. And there's some other really interesting ones coming up, including the psilocybin-assisted therapy for end-of-life distress with Dr. Gabriel as well. Also ones on the future of psychedelic industry and why so many firms and venture capitalists and bankers are investing in this field as well. So we'll go back now to the full screen and see if there's any last questions, or if Gabor, in fact, would like to make, here's another question. Sorry, Gabor, have you got time for one more question?
Sure.
Okay, thank you. Okay. Oh, this one. Okay. Your compassionate inquiry seems to be highly person-centered, but I'm wondering what you think about having a more active role as a trained practitioner, such as by performing Icaro healings, facilitating chair work, etc.
So the question is, what I think of when?
Gabor, I think where the question's coming from is that in traditions, in the shamanic traditions, you're seeing these medicines being used in a group environment, and there's often singing and dancing and other things taking place. Yeah. You then contrast that with psychedelic assisted therapy, which is in a room with two practitioners, one patient, and it's as far removed from that shamanic experience as it possibly could be. I think what the question is asking is, can those two be reconciled in any way?
Well, I believe so. Well, first of all, let's make a distinction between a therapeutic session and ceremony. So people do ceremonies with mushrooms, for example, or people can do psychedelic-assisted psychotherapy with mushrooms. That will not look the same. the ceremony might be a group experience, and often is, and I know people who lead them. And they'll be drumming and dancing and chanting, as well as reflection and meditation and quiet talking. When in the session, the therapeutic session, it's often one person working with two therapists, which actually takes you back to very early childhood when you were very small and you had two parents, except this time the parents are attuned to you and they're listening to you, and all their attention is on you. So they're two different modalities. They're not at all exclusive of each other. Certainly in ayahuasca ceremonies, it's a group experience. So when I was in Peru at the Temple of the Way of Light, there were 6 shamans, 24 participants, chanting and drumming. We didn't dance. But at the same time, I've also been in sessions with, say, MDMA, where it's just 2 therapists and 1 client, and there's room for both, in other words, and one doesn't exclude the other.
Well, thank you so much. We're extremely grateful to you for your time and your incredible wisdom and expertise and your experience. Blessings. And I think huge applause from all of us, and we very much look forward to your participation in many of our events. And yeah, thank you so much. And if you don't mind, Gabor, I'm going to give you a quick call in a moment. I want to just run something quick by you. What were you going to say, though?
Let me say one more thing. So just in terms of resources, you mentioned Tim Ferriss, and
Yes.
a lot of my talks are available on YouTube. So I'm not looking for money here because I have no control over it. But dozens of my talks are on YouTube. So there's lots of resources. They just Google my name, and particularly the podcast I did with Tim Ferriss, which is about 2.5 hours long. It's the sort of the deepest, most engaging conversation with me that's been recorded. So you're all welcome to watch it, as well as other YouTube lectures. Those of you that are therapists, I'm going to check out my compassionate inquiry course. You can find the website and do that. I'll mention a quick resource that I think is very modestly priced, doesn't involve my work. It's a group called wholehearted.org, and they filmed 2 events with me. One is called a Masterclass for Healers. The other is on trauma and addiction, and it's the best filmed, best produced rendition of my work anywhere. And they're selling them at a very low price. And it's a great organization. So I encourage you to check out wholehearted.org and my work and so on. So with that, I'm the one who thanks you again, and I look forward to further collaboration. Thank you, Tanya, and everybody else.
No, thank you so much. And we will put some of these links to your courses, also that wonderful Tim Ferriss interview, which I absolutely endorse, is excellent. And the wholehearted inquiry and all of that we'll put on the thank you note to everyone, and any other links you want to share with us, Gabor, we'd be delighted to share with all the registrants.
Thank you.
So thank you so much. I'll call you in a moment. Take care.
Okay. Bye-bye.
Bye everyone. Thank you.